Israel says it will ease its blockade of Gaza and allow in limited amounts of food and medicine into the territory. This comes after more than 2 months of a total blockade. International pressure on Israel has tightened in recent days over the lack of humanitarian aid, as well as the killing of hundreds of Palestinians in Israel's latest military offensive. For more now, we're joined by DW correspondent Tania Krämer in Jerusalem. Tania, is humanitarian aid now entering Gaza?
Well, I have to tell you, this was a surprise announcement by the Israeli Prime Minister late last night after the Security Cabinet convened. Apparently, according to reports here, there was no vote taken, and there's a sharp backlash by his right-wing and far-right coalition partners. Netanyahu had always said he will not allow aid in unless there's a new mechanism to distribute aid, because Israeli officials have claimed that Hamas has actually taken advantage of this aid. Now, he has said that there will be basic quantity of food going into Gaza. Now, we have, of course, we still wait to see what exactly that means. We understand from reports here that as early as of today, there could be some medical supplies going in, some flour. There has been no bread. Many people told me, at least in the last week, at all in Gaza, and also some baby formula. That is very important because of the high number of cases of malnutrition among children, but actually also among the adult population in Gaza. But we have also heard, as part of this backlash, that some of the far-right protest groups have called on the public to actually stop those aid trucks from going into Gaza.
Now, Israel is intensifying its military offensive in Gaza. What's the latest there, Tania?
Well, we're hearing reports from Gaza that there has been intense fighting, intense airstrikes across the Gaza Strip, and there have been about over 100 people have been killed. The numbers are, on the rise. We've seen that also over the past days. Among them also many children, according to the local health officials. There have also been reports there was intense airstrikes in Khan Yunis, with some reports claiming there was a special operation there. We don't have many details yet, but it prompted the Israeli military of releasing a statement, at least saying that there's no change to the situational assessment. But there have been, a large campaign there in Khan Yunis, and we're waiting to hear more about that.
On Sunday, Israel's military urged Gazans to go to so-called safe zones like al-Mawazi in the south, but Gaza's main emergency services say that the camp has also been attacked overnight. So where can people actually go and find shelter in Gaza, Tania?
Well, there is no safe place in Gaza, and I think, we've been saying this, and many people in Gaza are saying this for as long as this war has been going on. Even in al-Mawasi, in the first 15 months of the war, there have been strikes on the so-called safer zone. Now, what I'm hearing from people in Gaza, many have been ordered basically to leave from the military, from the northern areas, for example. They're trying to go now to the western areas, like in Gaza City, in the center of Gaza City, hoping that the area might be a bit safer. But, when you talk to people in Gaza, they're saying they're moving, if they're in an apartment, in a tent, there is really no sense of safety for them here. And I think this is what is so difficult to understand, because people just have no place to go.
Tania, thank you very much. Our correspondent, Tania Krämer in Jerusalem. We can now speak about this with Tess Ingram. She works for UNICEF, the United Nations Children's Fund, and joins us from Amman, Jordan. So, Tess, the UN just announced that 20 aid trucks with food are waiting to enter Gaza. Do you have any information on when Israel will actually lift its blockade and allow the aid to enter Gaza?
Yeah, that's right, Terry. We've been approached by the Israeli authorities to resume limited aid delivery, and we're in discussions with them on exactly how this is going to take place, given the conditions on the ground. But let's be clear, only a full and sustained resumption of humanitarian aid of all kinds, not just food, is sufficient. Anything less in this situation of absolute catastrophe and horror that continues to unfold between us is unethical. We need to make sure that we're bringing in a large volume of supplies to meet the great needs of families in Gaza at the moment.
Help us understand how this is supposed to work on the ground. How will the limited aid supplies be brought in? From where, and how will they be distributed?
I'm here in Amman in Jordan, where we have warehouses full of supplies, as do other aid agencies, but they've been sitting here for months waiting to go in. We're at week 11 now of this blockade that has been preventing us from doing our job. And we continue to call on the Israeli authorities, as we have been doing for months, to ensure that people's basic needs are met: food, medical, and other essential supplies that kids need to survive. So the supplies are here. This is not an aid issue. This is an access issue. And like we've seen throughout the 18 months of this war, we continue to have challenges bringing in aid and getting it to the people that need it. So how exactly this limited aid delivery is going to work, we're figuring that out. But what remains clear to us is, one, these supplies need to get in, and not in a limited quantity, in a large quantity. And two, those barriers that we continue to face in actually getting the supplies into people's hands, we need those to be addressed as well.
Given the intense airstrikes that are happening right now in Gaza, how difficult will it be to deliver aid safely?
Like 18 months of this war, it has been a constant struggle to get the aid in and to get it to the people that need it. And as you say, what we're seeing now on the ground in Gaza is the worst that we have seen. The situation for Palestinians in Gaza now is beyond atrocious. Children are being killed by bombs, they're being starved. There's reportedly more than 200 Palestinians in Gaza who were killed just in 48 hours this weekend. And these are lives, these are human beings. They can't just be reduced to numbers. So it's really important, I think, that we remember this isn't just about the blockade. This is about the continued bombardments that are killing and injuring children. They're really fighting off death from all angles at the moment.
Now, Gaza's health ministry, which is run by Hamas, says another big hospital in northern Gaza ceased operation on Sunday because of Israeli bombardment. Do Gazans have access anymore to medical treatment?
Not anywhere near the scale that they need, considering the number of people who are being injured by these heavy bombardments, the number of children who are presenting with malnutrition, and the rate that diseases are rising in the Gaza Strip as well. I've got friends and colleagues in Gaza that I talk to regularly, and the hospitals are completely overwhelmed with people, and the very brave and determined medical staff who continue around the clock to try and save lives are really struggling because of this blockade. They don't have what they need to save lives. And of course, indiscriminate attacks on heavily populated areas continue: hospitals, schools, shelters, tents, and this is in violation of international humanitarian law. So we need that ceasefire to be reinstated. We need the hostages to be released. We need the blockade to end. We need to be able to do our jobs.
Well, Israel is actually intensifying its military operation in Gaza, even though it's allowing some aid supplies in now. What impact is that intensification expected to have on the humanitarian situation in the territory?
I think we know the answer to that, Terry. I think we've seen it unfold live on television in front of our eyes for 18 months. We see that every day that this continues, it gets worse. That children are killed, they're starved, they're fighting for their lives, that parents are grappling with the horrible reality of trying to keep a child alive in that situation. I think for people in Gaza, it's plain and simple that they need this to end, and they don't need it to escalate. None of us want it to escalate. But we continue to see that this humanitarian catastrophe of epic proportions becoming a new norm under our watch. And this is really a moment for moral clarity and action, and we need the people with power and influence in this situation to stand up and say that this is enough.
Tess Ingram from UNICEF joining us there from Amman, Jordan. Thank you very much.
Thanks, Terry.